शुद्ध देसी रेडियो शुद्ध देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो.
Hi everyone, my name is Aditi Satkare and my colleague Ayan Raghunathan and I are excited to tell you about the interview we did with Dr. Sangvai, who is an OBGYN.
Hello everyone. Yes, we are super excited. We conducted almost an hour-long interview with Dr. Sangvai, and we have condensed it into what we feel is most important to you all for you to know. So let's begin.
First, I would like to give you all some background on Dr. Sangvai. She completed her undergraduate degree at Xavier University with a science major and a minor in Spanish. Her passion for medicine began when she realized she enjoyed medical-related classes, and she ended up going to the University of Cincinnati's medical school.
She said medical school was difficult at times, but when she got into her OBGYN rotation, she really enjoyed it. She had some good mentors, and it ignited a spark in her to pursue OBGYN. She ended up completing her OBGYN residency at Bethesda Hospital in Cincinnati. She says her residency was filled with lots of late nights and long hours, but it solidified her passion for the field.
And just to add to her impressive resume, she is board certified by the American Board of Obstetrics and Gynecology. She chose this route to keep up to date on all new changes and make sure her skills are as sharp as they can be. She does this by retesting for her certification, which she has to do every 6 years.
So Aditi, you mentioned her board certification. Is there any specific area within OBGYN she chooses to specialize in?
Yes, she has a practice designation with the pediatric and adolescent population specifically. So she provides gynecological care to that age range.
Wow, that is a pretty specific age range. Do a lot of adolescent patients usually face gynecological issues?
Yes, Dr. Sangvai said that issues do not usually begin until puberty begins, which is when they are adolescents. And there is currently a lack of providers in the adolescent population that are comfortable with working with these type of problems. So that is why she decided to specialize in this age group.
Well, now I'm also wondering if she sees any pediatric patients at all, since she said most of the time she is seeing adolescents who have started puberty.
She does not see pediatric patients as often, but when she does, it is mainly congenital defects, which means that they were born with the issue. Most of the time, it's the mom and the pediatrician who are concerned, and the pediatrician feels like they are not comfortable handling that situation. And so the mom usually brings the kid to Dr. Sangvai for a follow-up. Sometimes the issues are related to non-gynecological things such as mood, irritability, and psychological things. Occasionally, we have issues with girls and eating disorders. She said that it is a wide range of concerns that can happen.
Wow, she is. So Aditi, I have a question. Since she's still a practicing physician, does she have time for anything else outside of seeing patients?
Yes, actually, she is a clinical professor at the Medical College of Georgia. She says if she had not gone into medicine, she would teach because she enjoys it. She always looks forward to the students coming to her practice and getting to make a difference in these students' lives.
So has COVID impacted the ability of these students to come to her practice to get the hands-on experience?
Yes, since these students have not had a lot of in-person experience, Dr. Sangvai tries to help them learn how to interview and listen to a patient. She believes that this aspect is more important than the actual procedures or surgeries at times.
You mentioned surgeries. Does Dr. Sangvai perform any surgeries?
She does. She has a certification in intuitive robotics surgery.
What she does, she has a certification. Oh, I can't wait. You, wow, that is pretty cool. What is that?
That they use this for hysterectomies primarily, which is a surgical procedure that removes the womb. Medicine is evolving and robotic surgery is a booming industry. Intuitive is the robotic surgery company, and when you train under them, you get their certification. The company is based in both Atlanta and California. With this technology, they can make sure that the scars are less visible and reduce human error even further.
So is robotic surgery only common in the OBGYN field, or can other specialties use it as well?
All specialties can use it and it is becoming more popular, but specifically for OBGYN, Dr. Sangvai, it is a huge can of it. She says that a lot of people want to have a smaller incision after a C-section, less recovery time, so robotic surgery does a great job of giving the patient quicker recovery time and less pain.
So is it safe to say she thinks the field will only continue to gain popularity?
It is. Everyone is looking for a quicker recovery and less pain after surgery.
Dr. Sangvai clearly wears many different hats. I'm sure our audience is wondering what a typical day in life looks like for her.
She definitely is a very busy woman. She has been in practice for 25 years now. In the beginning, she would take the call at the hospital, which would be either 24, 48, or 72 hours, where she would do all the deliveries and take care of anything that happened in the hospital. But her schedule is very different now. Most of the time, the mornings are related to surgeries so that they can start as early as 7:30. If there are cases to be done, then that is what she does. Then she heads to her office to see her patients. However, some days can just be in the hospital or just in the office. It can vary. Every day is a little bit different, and Dr. Sangvai likes that variety.
It seems like an intense amount of responsibility. What does she like most about her job?
Her biggest positive is bringing a new life into the world. This aspect is what helped her decide that she wanted to do OBGYN. She is helping people, helping women, and seeing women from when they are young all the way through menopause. I think that women stick to their gynecologist or OBGYN more than they stick with their primary care doctors. So it is a really unique and rewarding experience.
Those do seem like some very strong positives. But I have to ask, is there anything that she does not like about her job?
It was hard for her to find negatives, but she said that it's the hours more than anything else. When she was on the call, it was the hardest, but she does not see it as a negative. She said that just like any job, you have to do things that you may not be, some things that may not be what you would like to do, but it's part of the job.
I think that is a great way to look at it. What does she do in her spare time for stress relief?
For stress relief, she likes to spend time with her two daughters, exercising, traveling, cooking, and volunteering.
I think it is amazing that she can balance all of this. What has she learned along her journey to help her manage all of her responsibilities?
She says that time management is the key to her success. Time management has helped her more than anything else. So she also says that having a strong support system, such as a spouse that helps out and good friends, are essential. She says that she cannot do everything alone and is not shy to ask for help or outsource duties that will make things easier for her and her family.
It's all very valuable information that she has given us. Did she mention anything about how pregnancy affects thrombosis?
Of course. So from what gathered, the risk of thrombosis in pregnant women is mainly venous thrombosis. When women are at a high risk of clot due to their hypercoagulable state of pregnancy, meaning that their blood is more likely to clot, they will usually develop a clot on their lower left side. The size of the uterus puts a lot of pressure on the vena cava, which is one of the many causes that increases the risk of DVT.
Oh, wow. So is there a way to prevent clots in thrombosis?
Anticoagulants are used to treat thrombus. Heparin is the #1 medication used in pregnancy, and it is the safest. In pregnancy, the risk is high, but it is important to keep in mind that after people deliver, the risk is about the same. Just because you've had a baby doesn't mean that you aren't at risk for thromboembolic events after delivery.
So when does the medication usually stop?
About 12 to 24 hours before delivery and restart it 6 to 12 hours after delivery. In Dr. Sangvai's practice, they call their patients after delivery, check up on them, and make sure that they're doing well. Ever since COVID happened, they have been doing a lot of telehealth, which has been a nice way to keep up with the patients and actually be able to see them.
Any advice on how women can prevent thrombosis during pregnancy?
Prevention and movement is the key. It's important to tell the patients to do that and keep their eye on things.
She seems to be so knowledgeable about this topic. We are lucky to have her as part of GTF. How did she become affiliated with GTF?
She met Dr. Laddu and his wife in 2005 at an event they held about continuing medical education. She participated in one of the talks at that time. They had asked her to participate and volunteer with GTF. She has gotten to know them well over the years and has become good friends with them.
Well, I'm glad they met as well. Did you have any advice to give to young GTF members, such as ourselves, who want to become a doctor or any kind of healthcare professional?
Yes, she wants everyone to know that they are more likely to be interested in what they do if they're good at what they do. Commitment is huge. If someone is not committed, any medical journey will be difficult. You must be good at science and be able to handle the rigor.
That is amazing advice. Does she have any advice on how to become a good medical provider?
She said that volunteering is a great way to see what medicine is all about. Exposing yourself is a key. One thing she thinks many people forget is that they live in a bubble where they live in good neighborhoods and go to good schools. It is easy to sometimes forget about the socioeconomic differences. It's good to volunteer in underserved areas because it will help you appreciate what you have a whole lot more if you see what people are doing when they don't have as much access. Another good thing is those camps where you can actually teach children because it gives you some teaching qualities, and as a medical professional, you are going to be teaching your patients.
This has been extremely informative. Thank you, Aditi, for all your insight.
It was my pleasure. We want to say a huge thank you to Dr. Sangvai for taking her time to complete the interview. We hope you all learned a lot and enjoyed this presentation. Thank you.
देसी रेडियो सॉलिड कलेक्शन है, सुरों के एक्शन है, दिल से कनेक्शन है, सॉन्ग सिलेक्शन है। शुद्ध देसी रेडियो, शुद्ध देसी रेडियो।